Hi there, Andrew with Zang Physical Therapy, and today I want to continue the conversation a little bit more regarding when leg pain is actually something more serious. And it's interesting that I had written this article for this week and talked to everyone early in the week because I just spoke to a gentleman last night who I'd seen a couple weeks ago regarding his concern for right leg pain, which has progressively gotten worse, and some swelling has come into the leg, and what was initially uh, down towards his foot and lower part of the calf is now creeping up a little bit higher. And he's been to multiple doctors, and I met him as we were just to provide another consult to see if there was anything else that could be done conservatively, because he really didn't want to go down the avenue of surgery. And so we talked a little bit more about the progression of his condition and did some examination of his muscle system and realized that that really wasn't provoking things, and everything that he was kind of believing based on his interaction with other doctors and his own research, that it was something a little bit more serious. And our conversation went down the road of, the conservative route just isn't really working, and I think I am going to have to go down the route of something from a surgical intervention. And he's been working, I think it's close to 6 months now, trying to get this issue dealt with, and it's getting very frustrated, and he's concerned for the potential long-term ramifications. And the moral of the story is, if a conservative route, exercise therapy, isn't the solution, and doesn't change your symptoms, and or the symptoms get worse, then it's incumbent upon you to seek out someone in the medical profession who's going to point you in the right direction to a provider who can actually help you. Because as this person is concerned, yeah, long-term issues could develop if nothing is done sooner than later. Unfortunate in his case. But he is working down the right path, albeit very slowly. And that, unfortunately, is all too common. And he's actually being proactive. On the flip side is where I most often run into people is they've had unusual swelling, or stiffness or heaviness in their leg with activity that's been going on a year, 2 years or more, and progressively gotten worse. And that creates a whole nother set of issues to be dealt with. One, from the medical perspective, intervening there, and then two, from a rehabilitative functional mobility standpoint. Because not only is their cardiovascular system, their arteries and veins and or lymphatic system damaged from all the extra fluid that's not being moved, but these people tend to also be deconditioned in that they don't tolerate a lot of activity. They want to sit around a lot. They become weaker, and now they get tired so very quickly, such that a simple trip to the grocery store is very hard for some of these people. So if you're someone out there, and the most common symptoms, heaviness in your legs, burning, tingling sensations, a feeling of fullness or pressure in your legs, and this is worse when you're up and walking, and if you lay down and get your feet propped, things will kind of seem a little bit easier. Those are things to be a little bit concerned about, and talk with your family physician, or if you've gone up the chain to maybe a cardiologist or a vascular doctor, what can be done to manage this beyond just medications. Because a lot of times they'll push water pills on people, and that can be helpful, but what else can be done? And the one thing that's not done enough is helping the person to get more active. And that includes maybe flexibility, maybe some strengthening, but definitely some cardiovascular exercise, be it swimming, be it on a stationary bike, be it walking. Any of those modes of activity are wonderful. Something that gets you moving, gets the muscles squeezing those blood vessels, pushing the blood back through those uh, pathways back up to your heart, and then just let the process continue over and over and over again. And that's how you keep your body healthy. So that is a part that is most frequently missing, and that's where individuals like myself come in, because we can guide people there. So if you've already had medical management and they're not going to do anything, then you belong with somebody like me to help get you active in a safe manner. And if all else fails, we can monitor your situation and help you to learn when something's not right, and then get you back to the right provider to help you out. So if you are dealing with any of those symptoms that I talked about with activity, burning, tingling, heaviness, fullness feeling, or worse, you're feeling out of breath when you're walking just a very short distance, it's time to do something about it. Don't just wait and see if it gets better. Nothing's going to get better. It might only get worse, so please don't do that. And if you have questions, see your PCP, talk with any rehab provider that you were working with, talk with a trainer you may be working with. Hopefully they will recognize some of those symptoms and punch you out to the right provider. If you have any more questions or thoughts on this, please feel free to leave a comment, send me an email. I love to have a conversation and try to help you get the right help that you need so you can get back to enjoying life the way you want to. Alrighty? Have a nice day.